The Joe DiMaggio Pediatric Heart Institute is a tertiary referral center. This program has started as a community-based hospital practice, and it has really grown into academia. We want to train exceptional pediatric cardiologists, whether they want to go and do general cardiology, whether they want to seek further training in various subspecialty areas. We are ready to prepare them to go out and be the best that they can be, focus on quality, focus on patient care, and really make a difference in every life that they touch.
Our fellowship program, although it's just getting started, has exciting opportunities. We cover every aspect of cardiology. We cover transplant, advanced imaging, interventional catheterization arena, and our surgical experience is second to none. We're extremely busy in every aspect of cardiology, and the pathology that we see offers a unique experience for the fellows coming through here and seeing things that typically we don't see generally.
We see people from all different backgrounds, a very diverse background. With that, we get a lot of different pathology. We have a lot of different specialty clinics also to follow these patients, bronchopulmonary dysplasia clinics, we have coronary artery clinics, we have a Marfan's clinic. So we have multiple specialty clinics that we're still growing even more that we have.
We have an excellent fetal cardiology program at Joe DiMaggio Memorial. We see a vast array and the most complex of the congenital heart defects as well. The fellows would be incorporated into the care of these patients as well. They would get training in general screening fetal echocardiograms. This means not only learning to diagnose them, but also to do the technical scanning themselves as well. And not only the diagnosis, but also compassionate counseling with the families about what this defect means for their child.
The fellows will get a comprehensive education, not only just cardiology, but ICU, and have some exposure to surgery. They'll come into the OR, they'll do preoperative imaging, they'll come at the end of the case and do the postoperative imaging.
Being in a program that is not very large, but that is not very small, is the best. Because as a fellow, you want to be exposed to different things. We are a referral center from not only different places in the US, but actually the Caribbean, South America. So you are in a program that you have exposure to all these things, but you are not gonna get lost because the program is huge, which happens a lot.
We have a really diverse patient population down here, specifically for heart failure and transplant, and so that's one thing that is unique to us. And we have a very strong reputation both regionally and nationally, and we're very fortunate that we have a very strong multidisciplinary faculty with expertise in all subsets of pediatric cardiology, in electrophysiology, in interventional cardiology, and so I really think people do get a wonderful, well-rounded experience.
As it pertains to the electrophysiology, we have the latest versions of the tools essentially. We do catheter ablation procedure, we have mapping systems. When it comes to device implants, we're essentially implanting every single type of device here. And in combination with our adult colleagues just across the street, we also adult congenital population, which is very important when it comes to electrophysiology.
The Pediatric Heart Institute currently has the largest faculty in the state of Florida. We have 32 pediatric cardiologists. We have 3 cardiovascular surgeons. We have a dedicated CVICU intensivist team, along with all the different subspecialty physicians that participate in the care of our patients.
Here, you will see what you need to see and more from a complexity standpoint, from a volume standpoint, such that you're competent coming out. And you will do that in a collaborative group that cares about your well-being and cares about maintaining a strong culture that's nurturing for you.
The fellowship and GME experience also includes a course of business of medicine. And in addition to the clinical training, in addition to the research training that we provide, there's also a focus on other things that are pertinent to medicine.
What sets us apart here in the training that we're going to offer the fellows, it is truly going to be comprehensive. It's not just going to be the diagnosis and how we get a patient through the diagnosis, but it's not uncommon for us to talk about the impact on the family and how that affects patient care. Cost is a big thing as well. It's something that we don't really want to talk about, but it's something that's very important, and we don't want to put families in a bad situation.
Our ultimate goal for our fellows, depending on whatever specialty, if any, that they choose to do, that they can go out and say that they feel comfortable managing a patient, seeing a patient, knowing that they've had the best training that they could get, that they see a little bit of everything as much as they can, and that they're able to experience everything that they want to experience, so that way they can go out and thrive.
Our goal is to train not just phenomenal doctors who are going to hopefully stay here and further, grow our Heart Institute and improve our outcomes, but are going to go out and practice in the community in other parts of the country, because we have the responsibility to train the next generation of cardiologists. We take that very seriously. It's a privilege.
My goal for a fellow is to allow that person, when they come here to Joe DiMaggio, that they actually are able to do what they really want to do. If they want to do interventional cardiology, we can get them into the best interventional cardiology. If they want to do electrophysiology or transplant, we get them the best programs to get the training that they want, so that they have the most doors and opportunities open to them when they're done. And they can go wherever they want to in the country because they'll be well sought after.
There's a really nice spirit at Joe DiMaggio, and that is really to provide the best care that we can for patients, to take care of one another, to take care of our families. And we really hope that everyone that goes through the training program here sees that and becomes an amazing pediatric cardiologist in the future.